Let's talk a bit about the Invisalign product here and the way it adjusts the teeth. You're again, we got to mention this because this is so fascinating to me. You're essentially taking a computer-aided drawing of the patient's mouth. You're extrapolating that from step A to step Z, which is where you want the teeth to be in the perfect alignment. Then the computer helps Invisalign, with your tweaking, determine exactly how many times you have to change your every 2 week Invisalign inserts to get the teeth to where they're supposed to be. And it amazed me because you mentioned one thing that I thought was kind of tough to do. You can actually rotate teeth a bit too if you need to turn them a bit in the mouth. I always thought it was more, back and forth or sideways movements.
Oh, that's a very good point, Norm. Teeth are held in the bone in 3 dimensions. So
Yeah.
if you think about it, to align the teeth, sometimes we have to bring them up, down, left, right, turn them in space. The other thing to bear in mind is what we see in the mouth is actually part of the tooth. So that's called the crown of the tooth.
Sort of like the iceberg.
Exactly.
Yeah.
Exactly. And I almost think of a tree and the root. So,
Yeah.
and it's actually called the root of the tooth. So there's some movements where we have to tip the root of the tooth or just turn the crown of the tooth. So there's many different movements. There's the front teeth, the back teeth. Teeth have different anatomy too, so they respond differently to the push and pull of the Invisalign that
Really?
needs to be factored in. A bigger tooth is obviously going to need either a little bit more pressure or a little bit more time to move the tooth. So it's there's a lot to consider when moving teeth, and we want to make sure the top teeth fit into the bottom teeth, and each tooth fits into the arch properly as well.
Yeah. Now, what about, you were saying that the majority of your practice is, 30-ish type people here. What about the appeal to older people too? Because I can imagine there are a lot like me who, when they were children, should have had braces, and either their parents couldn't afford it, or like me, they put up a stink and just said no, there's absolutely no way. I guess it's something we've got to mention is that, as you said earlier, it's never too late to get your teeth fixed.
Absolutely. What we're seeing a lot of now is limited treatment. Let's say somebody had lost a tooth in the back, and what happens with time is teeth tip into that space.
Oh, really?
If there's no support for
Sort
a tooth,
of like a slow fall into the pit. type thing.
exactly. And a lot of people now with dental implants are looking to restore that tooth that was extracted, say, 5 or 10 years ago. However, to restore a tooth and to put the implant properly, the teeth that are tipped need to be re-tipped back.
Straighten back up again.
Exactly. So a lot of times I work with dentists to restore the bite, the occlusion, the way it was initially, to have the dental implant placed properly. So a lot of times I'm seeing a lot more older patients in the practice. It may not be for full braces top and bottom. The front teeth could be fine. The bottom teeth could be fine. However, there's one tooth missing on one side, and the optimal treatment would be a little bit of orthodontic treatment prior to doing any sort of final restoration or prosthetic work, if you will.
Yeah. Now, it's quite interesting when you compare traditional braces, traditional wire braces, to the new Invisalign product. It's more, to me, it's almost like mechanical versus magic, because when you put on wire braces, it's still an adjustment, a very fine adjustment process that you have to go through. And you really don't have an image at the end as to what everything's going to turn out like 100% because it's something you can't really see.
Absolutely. I think in orthodontics, one of the biggest advancements, orthodontics has been around. It's the actual oldest dental specialty, over 100 years old. Invisalign, I think, has just really catapulted it into it's a whole new level based on that. I've met some orthodontists who are getting very close to retiring, who, when the Invisalign product came on, they were so fascinated with it and wanted to learn more and do more. They actually postponed retiring, believe it or not, because they found it so fascinating. They've been working with wires and braces their whole life, their whole career, and then you have this revolutionary product come out, and you're just so fascinated as to what it can do. And I even remember my first case with Invisalign when I was doing my residency, and you're kind of scratching your head saying, is this going to move the teeth? Like, you're just so programmed. And I have a lot of patients that come in, let's say, for example, a parent who had braces and knows braces work. Everybody knows braces have been tested. There's a history backing it. and they see this Invisalign product and they're very skeptical, and some of them decide not to do Invisalign because it's a new product and the history is not there. And then some of them say, okay, well, we trust you. You're the orthodontist. We've seen your work. We've seen other cases that you've completed with Invisalign, or our friends on the soccer team have Invisalign, and we just see the progress. You see the progress. Within 6 months, the teeth are getting straight, and they take a leap of faith, and at the end of the treatment, they're just blown away by what this product can do. It's remarkable.
Yeah, and I guess too, the other benefits are the fact that, as you point out, you don't see them. You don't notice them. They're not there to embarrass you. It's almost like, maybe not for you and I so much, but, other women, for example, who change their hair color. Well, as soon as they walk into the room, everybody goes, wow, you changed your hair color.
Right.
It's like that with braces. All of a sudden, poof, you walk in with a mouthful of metal one day, and poof, I got braces.
Right.
These you don't even notice. You don't even know they're there.
No. And what I ask a lot of my patients, once they start their Invisalign treatment and they come back in 6 or 8 weeks for their first adjustment, I ask them, has anybody noticed the fact that you're undergoing your Invisalign treatment? Yeah. A lot of them say no, and the ones that say yes are typically the ones that have removed it to show their friend or colleague, saying, look at what I have. And the ones that do that are proud they have Invisalign, and the other ones that tell them they will go through their whole treatment and people will not know what's going on, but every time they see their friend, they notice something a little different about them.
Yeah, and to me, too, the other big benefit is the fact that they are removable. So, and that's one of the things that had always concerned me about wire braces was every time you put something on a tooth, that's somewhere else for, germs and bits of food and plaque and all that sort of stuff to accumulate. This removes that threat completely.
Absolutely, Norm. Another thing I'd like to point out with the Invisalign team that we didn't mention, there's a concern with parents that teenagers will lose them because they're removable.
Yes.
So this is very, very, very important.
Car keys, cell phones.
Exactly. So a good indicator if the teenager is going to be responsible with the Invisalign is, do they wear glasses that they don't lose, or do they have a cell phone? I think most teenagers now, by the age maybe 12 13, have their own cell phone, and they're quite responsible. So what Invisalign has done to kind of circumvent this problem is they will replace up to 6 aligners at no charge. So let's just say your child loses it, you call the office and say they've lost aligner number 7, we replace it. To be quite honest with you, since I've opened my practice, not one Invisalign teen has lost their aligner.
Really?
It's remarkable. The other thing we do is if they're close to the 2-week period and they're ready to advance to the next one, let's say they lose it in day 12, well, a lot of times they can advance and there's going to be no harm with that short little window.
Yeah, a couple of days isn't
it's
not going to make that difference.
Very insignificant.
Yeah.
And the people that lose them the most, to be honest with you, are 40-year-old men who go on cruises a lot. Those are the ones they're the ones when we start their Invisalign, we have a feeling 3 months or 6 months, or when February rolls around, they're going to be on their cruise and we're going to get the call from them. So it's quite ironic how the Invisalign teen has kind of shocked all the orthodontists, saying they're a little bit more responsible than 40-year-olds.
Well, and I think you can show them now with the great computer graphics and digital images you guys use at the office. You can show them, and it gives them ownership because they know what the end result's going to be.
Absolutely, and we have to thank technology for that because it's huge. People like to know, just like when you're renovating a room in your house, you sit down with your designer, you know the colors at the end, you know the layout, you know everything. Before you even start to build or go through that construction, you know what to expect. Invisalign's no different. We have the end product in mind, the end result in mind, and it's fascinating and it's motivating to see the change from the beginning to the end, knowing what it's going to look like.
Okay, if you've got any issues at all, don't forget, check the office out, Orleans Orthodontics. The office on the web at orleansorthodontics.com. You can give Dr. Elijah Saikaly a call at 824-3200 and check out this fantastic Invisalign orthodontic product. Once again, my thanks to Dr. Elijah Saikaly for coming in. Good to see you today.
Thank you very much,
And
Mark.
once again, the website, orleansorthodontics.com.